Doctor, did you say that the patient had urography? No, I didn't say that. I did mention the word urography, but it is not something that a patient has. Radiography is concerned with the detection of urological conditions. Some special procedures are air pyelography, or the injection of air as a contrast medium into the renal pelvis through a ureteral catheter to demonstrate relatively non-opaque stones. Doctor, the SYN radiography of urinary tract, or SYN cystogram, is a urographic motion picture, is it? Yes, it is a motion picture to demonstrate transient or persistent vesico-ureteral reflux after having gradually filled the bladder with a radio-opaque medium. Doctor, what is drip infusion pyelography? Drip infusion pyelography is the intravenous infusion of a large volume of dilute contrast medium in conjunction with nephrotomograms, which provide detailed visualization of the renal pelvis and ureters. Doctor, that procedure is of special value in what respect? It is of special value in the detection of renal cysts. Doctor, what about excretory intravenous pyelography? That is the intravenous injection of a contrast medium followed by radiography of the ureters and renal pelvis. Doctor, the nephrotomography is what? That is a body section radiography of the kidney. Doctor, what is pneumocystography? Pneumocystography is the radiographic examination of the urinary bladder after it has been filled with air. This method aids in the detection of vesical tumors. And doctor, the renal artery infusion urography is what? That is simply the infusion of radiopaque medium into renal artery to demonstrate the state of the renal cortex and parenchyma, which cannot be seen in retrograde pyelography. Doctor, the retrograde pyelography that you mentioned is what? That is an X-ray examination of the urinary tract after the injection of opaque solution, which is introduced through ureteral catheters during cystoscopy. The calyces, or pelvis and ureters, are usually well demonstrated. And doctor, you mentioned retroperitoneal pneumography. Yes, retroperitoneal pneumography is the delineation of retroperitoneal organs by presacral insufflation using carbon dioxide as contrast medium. And the urea washout test, doctor? That is a urographic study for the detection of renal ischemia. Doctor, what are the normal findings? The normal findings are the radiopaque fluid is washed out in 15 minutes. It is positive for renal ischemia. The affected kidney retains the radiopaque medium 6 to 9 minutes longer than its mate. Doctor, the terms related to diagnosis by ultrasound are noted in your medical report. One is nephrosonography. Yes, nephrosonography is the delineation of deep renal structures by measuring the transmission of ultrasonic vibrations. And renal sonogram or nephrosonogram is what? That is a record of waves, ultrasonic waves, passing through the renal tissue for the purpose of determining the size and location of the kidney. Sonograms may detect congenital anomalies horseshoe kidney, agnesis, renal ectopy, aid in differentiating between hydronephrosis, unilateral multicystic kidney, and polycystic kidney, and demonstrate cyst tumor deformity. Doctor, you mentioned also the ultrasonic laminograms of the kidney. Yes, the sonographic renal section studies which delineate this layer of renal tissue and are a valuable adjunct to other diagnostic modalities. Vocabularious witness.
This is the third time this month